Following the commemoration of the Cancer Awareness Day, which was on the 4th of February 2026, the Edo Specialist Hospital organized a free medical screening program for early detection for cervical cancer, breast cancer, prostate cancer, amongst others. The Chief Medical Director of the Edo Specialist Hospital, Dr. Antonia Inibokun Ujoku, reiterated the importance of early cancer detection as a critical step in saving lives. The event, which had representatives of the Office of the First Lady, Mrs. Betty Okonovo, the Commissioner of Women Affairs, Mrs. Jonah Abdullah, and several health-focused organizations in attendance. The event, which was aimed at raising awareness, promoting early detection, and encouraging community participation in cancer prevention. The hospital noted that the outreach aligns with its commitment to proactive, preventive, and people-centered healthcare, stressing that early screening for breast, cervical, and prostate cancers significantly improves treatment outcomes. Speaking, the representative of the Office of the First Lady, Mrs. Betty Okonovo, said the First Lady, Mrs. Anene Desili Opevolo, extends her full support, saying cancer is one of the most deadly diseases, claiming innocent lives due to failed negligence and late detection, and encouraged men and women to participate in the event as lack of education and awareness has led to severe consequences.
A privilege to represent my boss. I have here her speech and I'm about to read it. It's a speech by Her Excellency Mrs. Desili Opevolo Anene, the Coordinator Office of the First Lady Edo State, at the Specialist Hospital, Benin City, on the occasion of the World Cancer Day held on Friday, the 6th of February, 2026. It reads, "Good morning, distinguished guests, healthcare professionals and partners. It is my honor and privilege to be here today at Edo Specialist Hospital. We know the CMDD says she's here with us in spirit. As we commemorate the World Cancer Day and Cervical Cancer Awareness Month. Two important occasions that remind us of our collective responsibility to safeguard the health and well-being of our people, especially our women, girls, and today we are seeing the men are being added. Today's free cancer screening initiative has been organized by a clear and urgent purpose to provide accessible screening services, raising awareness, and encourage early detection, which remains one of the most effective tools in reducing cancer-related illnesses and health. Cancer continues to pose a significant public health challenge globally, cervical and breast cancer in particular. After thousands of women every year, sadly, many cases are detected late due to limited awareness, fear, stigma, or lack of access to proper medical services. However, we know that when detected early, many cancer can be prevented, it can be treated, and can even be cured.
Speaking during the event, the Chief Medical Director of the Edo Specialist Hospital, Dr. Antonia Inibokun Ujoku, emphasized that cancer remains one of the leading causes of death, largely due to late diagnosis and limited access to timely screening services. Participants were encouraged to take advantage of the free screening and to serve as advocates within their communities by spreading awareness about the benefits of early detection. Healthcare professionals and partner organizations were commended for their dedication and continued support in advancing cancer awareness initiatives. The management further stated that the government has been in full support for advocate and promotion of health awareness program in the state.
Today's program is focused on awareness, screening, and education, key pillars in the fight against cancer. I encourage members of the public to take full advantage of the services provided and to continue spreading the message that early detection saves life. The theme for World Cancer Day 2006 is united by unique. And so, even for survivors, we say we are united with you in your pains, in your suffering, in the fact that you have to go through many courses. We are united with you as you go through that journey. We are united with members of the community to be sure that they are properly screened and even things are available for them. Why we keep emphasizing and doing advocacies is because of what we see in the hospitals. By the time we are done with cancer, it becomes difficult. If we say go and do radiotherapy, 2 weeks ago I had a patient who came in, and we saw her and we made that detection that she already has cancer. And I called UBTH. I just called and said, "Oh, is your brachytherapy working?" They said, "Not yet." And that means that by the time I was calling, I think it was Enugu's own that was, working. You can imagine where you now have to go to Enugu. The journey mapping for the patient is enormous. So that's why we say, well, please let us emphasize on the awareness. Because when we detect early a lot of these cancers, you can ameliorate the problem. You feel reduce the problem when it will happen when it dey early. Now when it don't dey spread, when it don't go everywhere, they go come need bigger machines, and not be every hospital get those big machines. Even for the country, the government dey try. Even all this one we dey do so. Our governor, Senator Monday Okpeholo, he support us, so he say make we dey do and make we dey create the awareness dey go. And especially with the office of the first lady awareness. So anytime when we call on them, they dey always answer us, say they give us the go ahead, say make we do wetin we go fit do. Now this one we go fit do, we go still dey plan to do more as our power reach.
Also speaking at the event, the CEO of OK Creative Future Foundation, Sovioleta Okeogene, shared a brief experience involving a colleague who battled cervical cancer, an encounter that inspired the establishment of the foundation. He further advised that cancer does not affect women alone, but it's also dangerous to men, urging both genders to actively participate in the screening exercise. According to him, early detection helps prevent further complications and save lives.
I lost a very dear partner to me, to breast cancer. Now I can say no, I no go stop this work like this. As the person don't die, I say I no go stop am. I go need to continue with this thing so that people no go die of this same thing wey be say me and all those people wey don't die no before. I want to talk to men especially. We dey do prostate cancer screening, they go for everywhere. But I discover say we know dey see men, and that is why I want to thank our CMD when he be saying she incorporate this very prostate screening join this program, because united by unique, we all dey together, we all join together so that we go fight this common cause wey the cancer. And wetin I wan tell the women, many people don run come my office, they go say, "Oh, oga, my brother," I say, "No, cover that, I no be doctor, I no be doctor." I go say, wetin be the problem? He say, "Breast dey pain me, I come dey put aboliki, I come dey rub this thing, I come dey use hot water." I say, no be that one be the cure. Run to hospital and we go call immediately either specialist or UBTH. That na wetin we dey do. So my advice be say, all of una wey come here today, make una no fear. If you do am and they discover say maybe e dey stage 1, e dey stage 2, it's curable.
The program concluded with a call for collective action, reminding the public that cancer is not a death sentence when detected early.
When we talk about cervical cancer, it's one of those cancers that can be prevented, that can actually be eliminated, because the cause of that cancer is known. The cause is a virus we call human papilloma virus. This virus, when usually is found in women that are sexually active, women that are up to the age, marriageable age, they have started having sexual intercourse. So you have the virus there. If it stays there for a long time, it begins to cause some kind of changes in the normal cells that should be in the cervix. And from there, you now have cancer developing over a period of years. It doesn't just happen one day. It doesn't happen in 1 year. It happens over years. So what we are doing now is to identify the potential for people to have cancer years to come, not today. And we are trying to prevent it as much as possible. And one of the ways we can easily prevent it is by having the vaccine. which is now available in the state and is free.
You see, everything wey get good side na get bad side. You wan say wetin dis prostate dey do? Na dis prostate dey put hand join wetin we dey call sperm, and if sperm no dey, we no go fit give person belle. So God put am say make e dey help us. But as we dey grow, anytime wey we don reach like age 45, you go see say normal way your piss suppose to dey jump bridge. Your piss suppose not to dey pass under bridge. But if you can't dey see say whether your piss instead make it dey jump bridge, you can't dey zuo, it dey pass under bridge, you know say something don dey happen.
Angela Ilegoma reporting for PFM Global News.